Okay, so I have a couple of announcements before we go into regular class. Announcement number 1 is July the 5th, which is next Monday. We will be off for the 4th of July. And it's also my birthday. I'll be the big 50.
Oh, exciting.
And my best friend bought a Camaro, so I don't have to do that as my midlife crisis or anything. I went and test drove a Sentra, and I am getting a new little car. She got a Camaro, so that's the difference in personality. I'm so happy about little Sentra. Cute, love it. I actually want a yellow bug, convertible bug, to put big sunflowers all over it. I could so rock that.
Would you do the eyelashes too?
The eyelashes too, are a red one with black spots and do a ladybug. Anyway, I'm just being silly, but yeah, anyway. So we get a 3-day weekend and I'm not just speaking to y'all, because remember, I'm recording this, so I'm going to be putting this on daily assignment so everybody can hear it. So sometimes I'm going to be speaking to everybody and not just the ones that are in front of me. So if you are behind in your assignments, you're going to have an extra day to get caught up. So that Monday. Also, I want to make sure that you're looking at your week at a glance, and I'm going to tell you why. If you text me when I'm driving down the road that says, hey, are we on day 19 of 40? I'm probably not going to know the answer, and I'm going to tell you why, because y'all were on day 19, but I'm like already on day 32 because I have to plan ahead. And I also have 4 classes. So sometimes I don't know what module I'm in unless I look at the name of the class that I'm actually planning for. And so it's hard for me to know unless I pull all of my stuff out and kind of dig through. So using that week at a glance, the reason I give that to you is because it answers your questions before you have to ask. I don't mind answering questions, but if you have the material to answer the question for you or the resource to answer it for you, try to look at it first, because I know that's hard. I'm going home at 5 o'clock and I'm being asked questions. What chapter are we in? Go to your week at a glance. It's going to tell you. Okay. So we're starting cardiology. As a cardiology coder, I know we've talked about this a few minutes ago, but I didn't have record on. I didn't use most of the codes in this chapter because really what we did heart catheterizations and things like that. So we didn't get into some of the more in-depth procedures that you'll find in the CPT because we were in Alexandria. It's a small town and we just did smaller things. So a lot of these CPT codes I've never seen or used, but that doesn't mean that I can't. It just means I'm not familiar with all of them. So if y'all say, hey, what's 3396 and what does that mean? I might have to say, oh, let me look it up and I'll get back with you. So terminology is very, very important in this chapter. As with all chapters, just make sure you're lining up your spelling. Because if you have an oscopy and an ology and an oplasty, those things are going to be a little bit different. So just make sure you're lining up your medical terms. Trying to think of what else. Also, getting in the CPT, looking at what's there, making yourself familiar. I think I gave y'all Queen of Guidelines. It was long, huh? I don't know who was able to watch Queen of Guidelines. Okay, it was long, but was it helpful? Okay, it's long, it's in depth. I only gave y'all part 1. There are 3 parts. But I only gave you part 1 because sometimes if we have a really strong jumping off start, then the rest of it kind of falls in line. Another thing I want to be sure that I tell you is you do have PowerPoint slides. Have you guys noticed that on your e-learning in your sidebar? You know, you have like overview, syllabus, coursework. There's now labeled PowerPoint slides. So you'll have PowerPoint slides for each chapter so that you can use those as you read if you want to. And sometimes reading those are going to help.
My baby.
Okay, any questions before we jump into the lesson? Okay, so we're not doing medical terminology today because I didn't make us a new slide, a new flip chart of that yet. But I do want to talk about what does cardio or cardio mean?
Okay.
It's the heart, right?
Mhm.
It's the heart. Ology means specialist. So if you're a cardiologist, you're a specialist of the heart. So those are your two new words, ology and cardio, or cardi, heart specialist. I'm going to share my screen. Oh, I don't know what I did. Sorry. Oh, guys, I am so sorry. I got ready for a new student this morning that didn't show, and then I wound up not pulling up my stuff. So give me just a minute. It's right here.
Mhm.
So the very first thing that we're going to do is we're just going to watch a little video on the cardiovascular system and just kind of get familiar, okay?
The cardiovascular system, also called the circulatory system, is the transportation system of the body. The major structures that make this possible are the heart, blood vessels, and blood. Simply put, the heart pumps the blood in order to move nutrients through the blood vessels to nourish and remove the metabolic waste from the body. The purpose of this video is to present a basic understanding of the cardiovascular system. A more in-depth study of the system will be presented in other CTE videos where we will look into each specific part and function of this system. The heart has two major circuits within the circulatory pathway which work together in a closed circulatory system. These two pathways are the pulmonary pathway and the systemic pathway. In the human organism, the right side of the heart pushes the blood through the pulmonary circuit so that it can be oxygenated in the lungs. The left side of the heart pumps oxygenated blood to the entire body. The blood is then returned to the heart via the systemic pathway, where the cycle begins again through the pulmonary pathway. It can be said that the heart is actually two pumps divided by a septum or wall. As mentioned in the muscular system video, the heart is an involuntary muscle that works somewhat independently from the nervous system. This will be explained in more detail later, but for now, let's take a look at what makes up the heart. The heart is a muscular organ with 4 hollow chambers. It consists of 2 atria, which are the upper chambers, and 2 ventricles, which are the lower chambers. The left and right sides of the heart are divided by the septum. The heart is also made up of 3 layers of tissues. The innermost layer is the endocardium, which is the thin, smooth membrane that lines the inside of the chambers of the heart and forms the surface of the valves, of which there are 4. Next is the myocardium, which is the middle layer. It's the muscular wall of the heart, or the heart muscle. And third, the pericardium. This is a tough, double-layered, fibrous sac which covers the heart. The word vessel has many meanings, but in anatomy and physiology, blood vessels are meant for carrying blood throughout the body. The blood vessels are similar to a two-way highway system. One lane, or direction, is known as the arteries, and the other is called the veins. Starting in the heart, the blood flows to the body through arterial blood vessels. The largest of these arteries is known as the aorta. These arteries provide the pathway for blood to travel to the body from the heart. Arteries are then further divided into arterioles and arterial capillaries. Arterioles are smaller blood vessels that branch out from larger arteries and lead to the arterial capillaries, which are the smallest blood vessels in the body. The arterial capillaries are connected to the venous capillaries. The arterial side of the capillaries is dropping off oxygen and nutrients to the body's cells. The venous side of the capillaries is picking up metabolic waste from the body's cells. Together they form a network where arteries and veins connect, completing the closed circulatory circuit. The blood flow from the venous capillaries will flow back from the body to the heart through the venous blood vessels. Similar to the arteries, only in reverse, the blood flows from the venous capillaries into a system of veins called the venules. These venules connect to larger veins which carry the blood back from the body to the heart via the largest veins known as the superior and inferior vena cava. Now that we have an understanding of how the blood moves throughout the body, we can discuss what it actually is.
If you've been diagnosed with heart valve disease and you have not followed up with your doctor.
Okay, so that's just a bit of a video just to kind of get you a little familiar with the anatomy of the heart. You're going to recognize some of the vena cava, the superior, and the atrial was superior, and I can't remember the other, vena cava. You're going to see those some. Not so much to give you a quiz on the heart in any way, but just to kind of give you a general understanding. And we stopped at the blood because we don't need to go into hematology at this point. All right, so some common medical terms for cardiology. And some of these are more like diagnoses, but I just kind of wanted to make you aware of them. The term angina, and I am videoing this, guys. So if you want to write it down, you can, or you can go back and view it later. I'll put it in daily assignments, remember. The medical term angina, that means chest pain or discomfort due to coronary heart disease. I even listened to how it sounded, sorry. Atherosclerosis. Is that right?
Mm-hmm.
Is a form of arterial sclerosis in which the inner layers of the artery walls become thick and irregular due to deposits of fat, cholesterol, or other substances. That's when we'll do a heart cath or a stent to clear some of that out. Atrial fibrillation, which we call AFib, is a disorder of heart rate and rhythm.
Mm-hmm.
Cardiomyopathy is a chronic disease of the heart muscle. Congestive heart failure, you guys have heard of that one, huh? That one's pretty common.
And good to be over breakfast on my
Inefficiency of cardiac circulation. So a coronary artery bypass graft, which cardiology coders call a CABG, that's a procedure, is a surgery that reroutes or bypasses blood around clogged coronary arteries, and improves the supply of blood and oxygen to the heart muscles. It's sometimes called open heart surgery. Okay. Coronary artery disease, which as a cardiology coder, I can tell you right now, the ICD-10 code is I-2510 because we used it that much. AFib's I-48.91, and I haven't done that in 4 years, so I still remember those codes that I use all the time. CAD, or coronary artery disease, is conditions that cause narrowing of the coronary arteries, reducing blood flow to the heart muscles, which again, we would do a stent or some sort of, sometimes just the cath would push it out. It just depends. Okay, deep vein thrombosis, DVT, is a formation of a blood clot or a thrombosis in a deep vein preliminary Say it for me.
Primarily.
Okay, listen, that one word got me tongue-tied, and I'm going to be fighting it the whole class. Primarily in the leg. I've had a test to see if I had deep vein thrombosis before, and it was just a scan. It was like an MRI on the leg. You can have an MRI on your leg, right?
Yeah, you can also have an ultrasound done too to make sure.
Yeah. And you can do something called a PAD, which is peripheral artery disease. Hypertension is a chronic increase in blood pressure above normal range. Okay, myocardial infarction. Who knows what that is? It's a heart attack. Okay, syncope. Has anybody ever heard of syncope? That's just the term for fainting. And tachycardia is an abnormally fast
heartbeat. Yeah.
Heartbeat. Okay, so I want to talk about, I didn't put it on here, but I want to talk about tachycardia versus bradycardia. Okay, so this is how you can remember, and I'm only telling you this because I worked on the cardiac floor at Rapides Regional Medical Center, and I could never remember. How do you remember what it is? So tachycardia, tachy women are fast. Bradycardia, the Brady Bunch, Brady women are slow. I know that that's probably not the most professional analogy you could use, but you really do remember it doing it like that. So there you go. So cardiology coding terminology, there's two things that you really need to remember. One of those things is invasive. So what is an invasive procedure? An invasive procedure is something that actually enters the body. So for example, opening the chest for the removal of a tumor on the heart or percutaneous placement of a catheter in an artery. Both medicine and surgery sections contain invasive procedures. So the opposite of that is going to be non-invasive procedures. These procedures do not break the skin. For example, an electrocardiogram doesn't break the skin, right? So invasive breaks the skin. Non-invasive does not break the skin. The cardiologist specializes in the treatment of conditions of the heart, but he may further specialize in the area of radiology, medicine, or surgery. So cardiovascular codes may come from 3 different sections of your CPT: radiology, medicine, and surgery. Just pick out the correct term. So if you have let me think, an echocardiogram, it's going to be, our nuclear stress test would be in radiology. I'm trying to think. I'm going to give we have some coding examples, so we'll wait till we get to those to do all of them. But like if you're going to do a pacemaker, that's found in surgery. Radiology are 7,000 codes, and then medicine starts with 9,000 codes, but not like whenever we did E&M codes, it started with the 99. Medicine's going to start with like 93428, you know, something like that. It doesn't start with a 99. So, okay, so in radiology, we do diagnostic studies. In medicine, they're non-surgical and percutaneous. Then surgery are open and percutaneous. So all of that's just words until we can put it in action, right? Let's put it into action. Can y'all see the whole thing? Because when I see it, I see you guys. Okay, there we go. I got you down at the bottom. Okay, so do you have your CPT manuals? And those of you who don't have your CPT manuals, it's okay. Where did I lose Miss Sonia and
I'm right here.
Oh, okay. Well, when I change my grid, I can see y'all. Sorry. Okay. So if you don't have your CPT book, We're just going to be talking about the processes. And for those students that are listening to this afterwards, we're just going to be talking about the process. So ladies that are used to coding, let's make sure that when we're talking about our coding, we're talking about the process too, so it can lend them some advice on how to look up codes. So the first one says a patient presents to the physician's office to have blood drawn for various lab tests. The venous blood is drawn by the medical assistant and sent to the lab with an order from the physician. Code only the drawing of the blood. Okay, so this is my question. What is a venous blood draw? A venipuncture. That is actually the appropriate name for a blood draw. So if you go into, like when I go to my regular primary physician and I need to have my blood drawn to have my levels checked, it's a venipuncture. So when we go to our CPT, we're going to be looking up, oh, doggone it. I don't know what I'm doing with this thing. Sorry, y'all. We're going to be looking up venipuncture. So let's go to our index in the back of our CPT. We're going to look up venipuncture.
That is. Yes.
That's my stuff. Daddy, please tell me, why would your wife be wearing something like that?
What?
That.
Hey, Sean Quill, can you mute us, sweetheart?
Mm-hmm.
It's on page 1187.
Okay, so on page 1187, we see venipuncture. But I want you to look up above that. You see vena cava. I'm sorry, I remembered that from whenever we did our anatomy. But when we look at venipuncture, we see child, adult, infant, and then underneath that is routine. So he's in the office and he's having his blood drawn. So would this be routine?
Yes.
So it is routine?
Yes.
And the only code it gives us beside routine is 36415. Okay, so do we stop there?
No,
Why do we not stop there?
we need to check it.
Because we always code
2 ways.
2 ways. So we're going to go to our tabular, which is where we're going to look up our number 36415. It's on page 296.
Collection of venous blood and venipuncture.
Oops. So beside code 36415, it simply says collection of venous blood by venipuncture. Who would have thought that blood draws would be found in cardiology CPT? I would have thought it would be in Path and Lab. That's just me.
That's
But
where I would.
this is where it's at. So what do you think that I've done?
Made a
I've
note.
labeled venipuncture.
Okay.
Because no matter what I'm coding ever, if it's a blood draw, guess what? I don't have to look at anything. I just pull my tab for venipuncture. That's just my way of thinking. You guys do not have to think my way. You can think your own way, but I just think it makes sense. So that's one code down for cardiology. Let's do some more. Okay. Pulmonary endarterectomy with an embolectomy requiring cardiopulmonary bypass. It's a mouthful, isn't it?
Mhm.
So, but what we're doing is we're doing an embolectomy. But we may be able to look up the endarterectomy and find the same thing. But this was the path that I chose. I'm going to look up the other one and see what I see while y'all are looking at that. So if we look up the endarterectomy. Well, I'm just going to tell you, if we looked up this word, endarterectomy, it gives you the exact code, but I chose embolectomy because sometimes there's more than one way to get where we're going, right?
Right.
So I'm not wrong. I just took a different route. And if we choose the wrong word to look up, what happens? Nothing. We choose another word, right? So it's okay. Come on. Okay. So I went the embolectomy route, then I went pulmonary artery, and it gave me a choice of these three codes. So how do I decide what my code is? I go and look up these three codes, right? So let's go to our tabular and let's decide what the correct code is.
It's on page 267.
Okay, so by the route that I went, we have a choice between 33910, 33915, and 33916. So what would be your choice?
33910.
Oh, I would work 33916.
I was going to do 916.
Who said 33910?
Me.
No.
Sean Quill? Okay, well, let's look at, I'm going to go back to our scenario so we can talk about why, okay? Let's go back and talk about why. Okay, so it says with embolectomy requiring cardiopulmonary bypass. If we look at 33910, it's pulmonary artery embolectomy with cardiopulmonary bypass.
But 33916 kind of have it up.
Okay, it says pulmonary endarterectomy with or without embolectomy with cardiopulmonary bypass. Do you see the difference? It's one word.
Oh, with or without.
Well, what do you guys think? What's the one word that we have?
Endarterectomy.
It's that, yeah.
It's that endarterectomy word. It was just off by one word. So that's the thing in cardiology. Watch those words. And I know it's hard when we're doing the scenarios and we're doing it that way, but that's the reason that one's correct. It's just because of that one word. Okay, now let me ask you something. If you coded a 33910, do you think it would pay?
Yes.
It would pay, but what would it pay?
Less.
Less money, right? Because the higher our codes go, the more money we're going to get for those codes, right? And the more codes we use, the more money we're going to get. But we have to make sure that the codes line up with the medical records. Because if they can pay you less, guess what they're going to do?
Pay you less.
They're going to pay you less. And the doctor keeps a running tally in his head. I did this month, this month. I did 5,000 EKGs, so I should make about $5,000 because, well, a little more than that, because Medicare pays about 13 cents for those, by the way. That's what the doctor gets paid for an EKG. And guess what? He wants the 13 cents, so you still have to code it and bill it.
Mhm.
Oh, 13 cents adds up.
Yes, it does. It actually adds up, yeah. But anyway, okay, so does that make sense to everybody?
Yes.
All right. Hold on to your hats, folks. Because we're doing a temporary pacemaker. I know. All of these words, what do I tell you about all the words? Do not be scared by the words. Do you know what the most important thing to know in this scenario is? It's a temporary pacemaker and we're placing it. All this other stuff, oops, it's just really just describing what he's doing. Do we have to know that he stuck this there and he went through that? And in this scenario, pacemakers, we do not. We just need to know that it's a temporary pacemaker, not a permanent pacemaker.
Right.
It's a temporary pacemaker. That's what we have to know. And if it doesn't say leads in the scenario, it's electrodes. If it says like dual lead pacemaker, you're going to be looking at leads. So
Okay.
I got on this morning and really researched leads and electrodes, and they interact so much. The only thing that I could find is, unless it says leads, do not use leads, use electrodes. Also, I want to say one more thing before I go back to the scenario. Medicare does not pay for temporary pacemakers. Just a little tidbit that I know. Every now and then I got it because I know about this much about everything. So I was like, Medicare doesn't pay for temporary pacemakers. So I just thought that was interesting. Okay, so what we're looking for is a temporary pacemaker. So you can do this two ways. You can go to pacemaker.
That's what I just did.
But you also have a huge part of your index that is cardiac assist devices. So you can look it up either way. You have two choices, pacemaker or cardiac assist devices. We did an insertion and it's electrode. And there's lots of choices, but I just did 4 choices so we could decide which one it was. So once we get our code ranges or the codes we want to look up, we then go back to our tabular and we decide which one is actually the correct answer.
Right. Right.
Go back to the
I was just about to ask if we can go back to the
scenario, please.
question.
Sure. Oh, hang on. There we go. If I could get it on the right page. Now remember, we're just concerned that it's a temporary pacemaker. And we're going to be using the ones that say electrode.
Okay.
And I gave y'all 3 choices of code, or 4 choices, sorry.
So it's placement, not replacement.
And another word for placement's also insertion. When they're placing the pacemaker, they're actually inserting it into that little pocket.
Okay.
So do we have any guesses yet?
I think 33211.
That's what I got.
Where does it say dual chamber?
Whatever. Get me.
Okay, it doesn't.
Okay, look at, okay. All right. I know, I'm mean. This is what you have to look for. Dual means what? More than one.
Yes.
You have to look for the S. It was wire. There was no S, right?
Right.
So it's just one. So unless it has dual chamber or it has the S at the end of those, we're singular. So it's not dual. I know I could have told you that ahead of time, right? So
Is it
33210. Yes, that's right. Insertion or replacement of temporary transvenous single chamber, because we didn't have the S, which makes it plural.
Okay.
All right. I want y'all to look at page 244. Do you know what that is? It's a cheat sheet. So instead of going through all of this in the back of your book and all these things, label it and use it for pacemakers. And then on the other side, that's where your temporaries are. And you can find your other pacemakers and electrodes or replacement of a battery or all these things here. Guys, whenever I was a cardiology coder, this is what we used. We used these things, these cheat sheets. So I want you to be aware that it's there. Okay. All right. So an echocardiogram, transthoracic, complete study with color flow Doppler and echocardiography. So when you go back to the index, you're not going to see echocardiogram. What you're going to see is echocardiography. So once you find echocardiography in your index, you're going to go down until you see transthoracic. And it gives you these code ranges. So we have to go back to our tabular and we have to decide which one of these codes matches the best. And you're not going to have to look hard.
Go back to the. on page 737.
Okay, complete study with color flow. I know there's lots and lots and lots of words in these code descriptions, right?
Right.
I only see one with color flow though. I see, what does 93306 say? Echocardiography, transthoracic, real time with image, blah, 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 complete, and with color flow. What do you think?
Perfect.
So many words, right? But whenever you start saying, looking for that with or without contrast, with contrast, without contrast, with color flow, without color flow, when you start learning to hone in on those words, and if you'll highlight those words as you're coding, you're going to automatically see, okay, this one's with, this one's without. So it just means exactly what we were talking about earlier. Get in those manuals, get to know it. It is time consuming, but it's your career, right? It's not just going to be your job, it's going to be your career. The more you know this manual, the more that you're going to know on your NCCT, and you're going to feel comfortable. And this is building blocks. Remember when you guys first started E&M coding and you were like, what have I done? Antoinette, I got that call. I don't know if I want to do this. And I was like, come on, you got it. Just stick with me. Just stick with me. Do you see how everything has built? Everything has built. This is the toughest coding chapter. Take your time. Get to know your manual. Look at those. Look at your prefixes. Look at your suffixes. Just make sure they're lining up. With or without. Is it plural? Is it singular? It's all there for you. Okay, well, that's all we have for today. I just stuck our toe in, right, today? Just sticking our toe in. But coding class is Thursday. Come ready to code, coders. I'm telling you. We are going to have fun on Thursday. We are going to be coding. I do want to tell you a little tidbit. Make sure that you know these coding scenarios that we did today, because they may or may not be on your exam.
Uh-oh.
May or may not be on your exam. Boy, that's vague, isn't it? All right. So you guys are just getting started with cardiology. Shanquil and Miss Elise, I have texted about I have emailed about your manuals.
Okay.
And so I'm getting back with her with your names right now, and she's going to track them, and I'll be texting you and letting you know where those are.
Okay, great.
Okay.
All right, guys. Well, great class. I hope you learned something. I know we went a little slow, but I think that we go slow today so that when we get back here on Thursday, it's going to be like, what's that, smooth as butter. Smooth as butter. Have a great afternoon. If you need me, let me know.
Okay.
Bye,
Nice meeting you
ladies.
guys.
Thank you. See
Bye.
you later.
Have a blessed day.